Hello viewers, welcome to my YouTube channel as usual, and please don't forget to subscribe. My name is Sister Dr. Juliet Wangui Macharia. I'm a gynecologist, fertility educator, and medical management doctor dealing with issues pertaining gynecological and obstetric complications. But again, I deal with fertility issues, women with infertility, male with infertility. Please don't forget to get and to understand more about your issues. Today is a continuation of our menstrual cycle. The science behind this menstrual cycle, it is so vital. It is very vital to each woman in this planet. We need to understand what is it, because it is all about us. It is our life. Menstrual cycle is your life as a woman. So if you don't understand, you may not even know what is happening in your body. So we were talking about the bleeding. Today we are going to talk about something very important. And this is the most important part of the menstrual cycle, the ovulation. Ovulation is very crucial. It is very important. And it's very sad, but people will try as much as they can to stop ovulation from occurring. We take contraceptives. We prevent ovulation from occurring because we do not want pregnant. That is the main aim. We want spacing. But how I wish, my dear people who are following me in my channel, how I wish we will understand how precious ovulation is in each woman. How precious this mechanism is important in any woman. Whether she's young, in her early 20s, in her late 20s, early 30s, late 30s, early 40s, ovulation is it is actually, it's like a vital sign. When a doctor checks at your blood pressure, puts a machine around here and tells you that your blood pressure is 200/120, actually we say this is an emergency. We have to manage you. We have to manage you because the blood pressure, your heart is overworking. Something is not okay in the heart. When you come to a doctor with a very high, sugars are very high, such that as we test your blood, you find that the machine cannot even record. The sugars are very high, past the normal ranges in that machine. We say your sugars are unrecordable. We say this is an emergency. You find doctors rushing, making sure that you get we get a vein, you put a cannula, we canalize you, and then we start giving you fluids. Yeah, we put a monitor. We want to monitor you very closely, and then we start checking your sugars as we are managing you. It's an emergency. You come to the hospital, you are bleeding. Maybe you have been involved in an accident. We check your blood pressures are low. The pulse rate is very low. We get hold of your hands, we call it them, the upper limbs and the lower limbs, the extremities. They are cold. We say you are in shock, and we rush to help to save you. But we do not understand. When you do not ovulate, it is an emergency. We take it because it's not an alarm. We just take it very simple. After all, I don't need to. After all, what is happening? We take it just very simple. Ovulation is also a vital sign to any woman in their reproductive age. And any woman who do not ovulate is not healthy. We need to manage you the way we manage others when they have emergencies. So let us understand, what is this ovulation we are talking about? After the bleeding, let's take a woman with a cycle of 27, 28, the normal one, which most of the people say this is the normal cycle length. But remember, cycle length can be between even 24. The updates have shown 24 to 36. Some books will go above 21 to 35. It's all, but the updates, according to FEM, which people have done a lot of research to come up with these scientific facts, 24 to 36 days, that's a cycle length. So let's take less than an average of 28 in this lady, and she bleeds for 4 days. Then after 4 days, she's a bit dry. Then she starts noticing some moist in her vulva. When you talk of the moist, we are not talking of the moist that a woman experiences when she's been stimulated or during sexual intercourse. We are talking of natural moist. It is just occurring natural. It doesn't need any stimulant. It is just occurring. Yeah, very natural. Just as the water flow when it's all the way from the mountains and it's just flowing. So this cervical mucus is just flowing. She will notice this moist. And this moist can be there depending, on what is in her body, maintaining the levels of her hormones. It may take between 4 to 6 days, 4 to 5. There's that moist. And this moist, which will present as a vaginal discharge, but a normal, is normally non-smelling. It's not for-smelling. No smell is coming from it. It does not make you to start, it's no irritation, so you don't need to scratch. You just find it. When you touch your vulva, you can feel it. You can feel the texture. You can look at it. It's clear. So it increases as the time goes. So as it is increasing, you find you'll be touching and it's just, So as the day increases and we have talked about being masters of our own body. So this science, you just take at your vulva. You have the vulva with you. You don't need to be highly educated to understand this. What you need is your hand. You already have your vulva. You just need your eyes and you have to feel the texture. So you look at it. Wow. As the days goes, it is increasing. You see? Increasing, stretchy, and it's clear. Yeah? It's stretchy, it's clear. That's a biomarker, a very important biomarker in any woman in this world. Yeah? I'm talking of this because we want it. We don't want it to remain there. We don't want it to be this. We want it to be wow. You understand? So this is what we say. And every woman needs to understand this so that we're able to know more about what is happening in our body. Please don't forget to subscribe and learn more about this special gift, the cervical mucus. What is the use? What is the use of it in our bodies? What role does it play? Don't forget to subscribe and follow me in my coming up YouTube channel. Thank you and God bless you.